professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. And in this video, I'm going to be going over how to better understand the social determinants of health, but in the context of specific diseases. I think social determinants of health are so important, and it has, of course, come to the forefront due to the pandemic. But I think it's so important that it should be infused into all curricula, whether it's in different disciplines or even disease-specific characterizations. So this goes into first talking about, this is commonplace, talking about health disparities, health equity, and social determinants of health. And so this goes into the same kind of narrative where internationally the term health equity has traditionally been used to encompass the range of population inequalities resulting from demographic and economic characteristics. And definitely this is being used in most instances in the United States as well. So they're known as the social determinants of health. How do we look at the nomenclature? This is the social determinants of health. They are the conditions in which people are born, grow, live, work, and age. And then these circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. The social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status seen within and between countries. So you review social determinants of health and diabetes. The inclusion of social determinants of health determined representation within one or more existing frameworks. So a lot of these, now the application comes in because you're primarily looking at adult populations, and socioeconomic status and diabetes has a complex sort of connection. Thinking of it as a so you should think of socioeconomic status as more of a multi-dimensional construct that is inclusive of education, economic, and occupational status, rather than just a measure that you look at maybe to control for in passing. So it might be beneficial to specifically look at this measure and kind of peel the onion back and look into specifically what other areas are this is impacting. So SES is a consistently strong predictor of disease onset and progression at all levels. SES for many diseases, including diabetes. And then this goes into the connection between access to resources, including healthcare, housing, transportation, and nutritious food, and social resources such as political power, social engagement, and control. So then this document goes into a comparison between 4 different models, and I actually appreciate this figure and have used it in different courses. So this is actually this is implemented in the ethics course within Walden University in public health. So this goes into social determinants of health and component factors included in the diabetes review. and this is interesting. How some of these food choices and what is supported by SNAP is associated with higher risk of progression to type 2 diabetes in people that already had prediabetes. So how specifically this, even though this paper was looking at multiple social determinants, socioeconomic status was the main focus. And so just looking at the connections, you can go through the details of this paper, but socioeconomic status interventions and diabetes outcomes, you can kind of see how low literacy may lead to worse outcomes, and some of the employment and occupational status, neighborhood and physical environment and diabetes, housing. So stable housing is an important component of this, and looking at, of course, built environment and diabetes outcomes. Again, I love tables because they really provide descriptions. And so this one goes into the description of SDOH intervention recommendations. And this may be helpful, but then you want to make sure that a lot of these are on a population level. And I can. So these are all of the organizations that are associated with trying to understand social determinants of health, especially the ones, some from the medical perspective, some for public health, for instance, CDC, and then some from the context of nonprofit services. And then there are 5 diabetes research recommendations. Consensus is needed around language and metrics associated with social determinants of health. Examinations of potential differences in pathways or impacts of social determinants of health based on traits including diabetes type or diagnostic category. Again, age group, children and youth, adults, older adults, and different socioeconomic status, wealthy versus middle class versus poor. Recommendation 3 is prioritizing next generation of research that targets social determinants of health as the root cause of diabetes inequities. And to understand how this is at the center of everything, you have to understand what are the impacts, and seeing patients firsthand and then applying it to kind of a community level is important. So partnerships, academic institutions, government sectors, and public health entities are required in order to design and test observational and intervention studies. Use dissemination and implementation science to ensure social determinants of health considerations are embedded within diabetes research and evaluation studies. So for clinical research programs, dissemination implementation methods will shorten the translation gap. And translation, oftentimes in science, is very difficult because there's evidence-based interventions, and then those that don't have too much evidence, and you're kind of shooting in the dark and trying to understand what the evidence, what the effective intervention is. And then train researchers in methodologies and experimental techniques for multi-sector and next-generation social determinants of health intervention studies. So there's also organizational interventions, which are important to note. Social context and diabetes, and linkages across healthcare and community sectors to address social determinants of health. So here's the discussion. And here's some references. And there are quite a few here. And so that sums up this paper. I think there's some key findings and takeaways that is important to look at. One of them is the fact that social determinants of health is the center of diabetes, and looking at, of course, food insecurity, but also stable housing and health literacy and some of these other factors in order to understand diabetes more completely. And I think this paper goes into that in fair amount of detail. And so if you get a chance, go over this paper on scholarly journal article on your own. Thank you for listening.